Good afternoon. This is Rob Rotman for Adapt Chicago Productions. I am very pleased today to introduce my fellow adaptee, Mr. Ryan McGraw. Ryan, how long have you been working at Access Living?
I have been working at Access Living for about 10 months now.
What is your position at Access Living?
I am the Health and Home and Community-Based Services organizer at Access Living.
So how has experiencing homelessness affected the health of you or the people whom you work?
So homelessness has a very negative effect on the physical and mental health of people because they're wondering where they're gonna sleep at night. They're wondering what food they can eat or if they will eat. They, especially in weather like this where it's freezing outside, the coldness cannot have a good effect on the mental or physical health, and not having money for the most basic of things.
What steps could you take to better your health if your rent were lower?
So you would have more money for food. If you were on SSI, which is a little more than $700 a month, that extra $100 would give you availability to free up some money to buy food, to buy warmer clothes, to buy a winter jacket. And to buy generic things like toothpaste or soap, and just so you are cleaner.
What is, do you know what is like the rate of homelessness, people with disabilities who are homeless in Chicago?
Honestly, I don't know the answer
But
to that.
Access Living can kind of help. If a homeless person came in, you would be able to provide him some resources.
Yeah, we have like a housing counseling group where people go through some classes and they learn resources. We don't promise to be able to find housing, especially because the rate for subsidized housing is so long right now, but there are some resources we can provide. And one of the things Access Living is working on is getting the homeless shelters in the Chicago area to be accessible, and that is needed so that people can get out of the elements and have a warm bed.
Right, the perfect comforts. What happens to a person, let's say, the health of a person who ends up in a nursing home or group home for a year?
Well, in a nursing home, I think more than one's physical health, the mental health deteriorates. In the nursing home, you don't really have choices. You don't even have the basics like a phone.
Yeah.
You may be in a room with a roommate. They someone is there to tell you what to eat, when to get up, and you don't have those choices we take for granted.
Right.
So your health deteriorates, mental health deteriorates,
Yeah.
and not only that, um, if the quality of food is bad and they don't take good care of you, you could develop other health issues like bed sores or other diseases.
I mean, I know, well, I'm living in an assisted living facility, Brookdale, and they're very, I can come and go as I please. And I think I think they can get better, but I'm trying to get them to better, to give people a sense of dignity. A lot of these people are older. They should be able to have a decent, end of life. I mean, where they can be productive or, hey, they've worked and, or, so that they can have a sense of dignity. I know there are a lot of homeless children. How do children with housing instability perform in school?
Well, housing instability negatively affects a child's performance in school. Some of these kids come from single family, single parent families, and really negatively affects not having that home security
Right.
or that parent influence to the work especially. I'm not blaming the parent either.
Yeah.
Some of these parents are working 2 jobs and don't have time to nurture their child because they are worried about
Yeah.
their next meal or how they're gonna pay rent.
What are solutions for housing-related health problems?
And I think some solutions are really that if organizations came in and really looked at the problems and
Yeah.
yeah,
What are some examples of social determinants of health? I mean,
income, employment, education, childhood experiences, physical environment, social supports. So those are all examples of social determinants. And as we see, if you have a higher, if you have a higher income, if you grew up in a wealthy household, you are more likely to go on to a college and have the ability to buy or rent an apartment in an area you choose, likely that would be affluent, than opposed to if you grew up in like a neighborhood, say on the south side of Chicago, where it is poor. The schools aren't, so they are lacking resources. and you see gang activity and drug activity on the street.
Right. Is poverty a social determinant of health? I mean, do you feel, I mean, I know I grew up in a small town in Iowa and then I lived in academia, and it just seems to me that people don't have resources, aren't in the greatest of health, and, I mean,
Yeah, like I was just describing, if you grew up in that situation on the south side of Chicago, you wouldn't have the same, you wouldn't
Opportunities.
be expecting the same opportunities.
right,
You may not even know
right.
that those were available to you. So,
I mean, what has
and
fascinated me, Ryan, with homelessness in my lifetime, that I know Ronald Reagan always said, well, people are homeless because they want to be. Do you agree? Or should I say, what would you respond to that? I mean, I've had so many people say, well, that person wants to be homeless.
I don't think, I mean, this isn't my opinion, of course, but I don't think anyone would want to be homeless. I mean, I can't speak for everyone, but who would really, really want to be on the street wondering where they're not, if they're gonna have food for the day, not knowing that they have no money, knowing that they have to beg for money, knowing they don't have a job or sufficient. I mean, a lot goes into it. How, like I said, how you grew up
Right.
and your experiences.
Where do you see the majority? Where do you see the majority of food deserts in Chicago?
The south and the west side, the areas where there are low income, and in these areas there are also pharmacy deserts. There's lack of public transit, lack of medical care. So it's not only food deserts, but it's what you really need to exist in a life-sustaining way,
Right.
like they do in more wealthy areas.
Right. How does a person's insecurity to pay rent each month affect a person's mental health and other aspects of their lives?
The insecurity to pay rent has a very detrimental effect on a person. If you're constantly worried about the possibility of homelessness, I could only imagine you would be very paranoid and thinking every month, how do I provide for my family? Where do I cut my costs so I can stay in this house?
Right.
How can I do other work so that I can have what I need to pay my rent? So, it's a very sad thing that you can't be that we rely so much on the dollar and not just say, this is what a person needs to live. And housing is a huge factor in the health, and people often don't see that.
So what does Access Living do? I mean, I believe that's an organization called DRAC. Now, what do they help people do?
So DRAC is a housing advocacy group. Right now, they are working on the homeless shelter campaign, and other issues. So the homeless shelter campaign would make the homeless shelters accessible in Chicago. They are also working on getting more housing vouchers, subsidized housing vouchers released in Chicago. And really, another thing is having more housing accessible in Chicago. Right now, only about 1% of housing in Chicago is accessible. That is not good. I mean, when one out of five people are disabled, why is only 1% of Chicago housing accessible?
So a person, if they were interested in these issues, would call you at Access Living then?
So for housing, Kathleen O'Brien organizes DRAC, and you can contact her if you want to get involved in housing advocacy. If you are homeless and you want services in finding housing, please call Access to get involved in a housing counseling program. We offer information and referral services. And you can get a hold of Access Living. Our phone number is 312-640-2100. And yes,
Great.
so
So there is help.
yes.
Great. Okay, well, Ryan, I think we're out of time, and please come back, and we'd love to have you and, maybe Kathleen come on again and
Okay.
obviously deal with these issues.
Can I just
Well,
talk?
please do.
Okay, thank you very much for having me. And one of the, can I just talk a little bit about what I do?
Yeah.
So I organize two groups, Independent Voices and the Task Force for Attendance Services. So our main goals is to get people the services they need to live and stay living in the community, so they do not end up in a nursing home. healthcare is a huge social determinant of health, and people need medical insurance to be properly cared for.
Right.
Prescription drug prices is rising, and insurance is not covering that. So there is a great need for people to have the health care they need and prescription drugs they need to survive.
Right. Well, thank you very much, Ryan. We hope to have you on again. This is Rob Rotman for Adapt Chicago Productions. Thank you.
Thank you, Rob.